UNIFEM is the United Nations Development Fund for Women, and we work on securing women's rights.
One way UNIFEM is working to advance women's rights is through gender-responsive budgeting. Gender-responsive budgeting examines how the allocation of public funds benefits women and men. It also analyses how tax policies affect women and men. By pointing out imbalances in addressing women's needs and rights, gender-responsive budgeting helps government correct inequalities. In India, UNIFEM is partnering with governments and a number of local NGOs in 4 different states to make elected representatives and civil servants aware of the benefits of including a gender perspective in the budget and of women participating in the process.
In 2003, when we have prepared the budget, that time we have allocated budgets for various requirements, various sectors. During those period, nobody was talking about women empowerment and gender budgeting. UNIFEM through Singamma Srinivasan Foundation have involved women corporators in the process of discussion. Then later on they deliberated and discussed in the council thoroughly, and then they influenced the budget making process.
In Mysore, local representative Pushpa Vali, using skills she learnt at a local gender budgeting workshop, convinced the municipal authorities to allocate money for a much-needed health centre that treats patients for free.
I was elected in 2001, and by that time we became only passive spectators in the budget meeting. In 2002 and 2003, Singamma Foundation, with the assistance of UNIFEM, they gave one workshop in which we awared ourselves what is budget and how to participate in the meeting.
Where the 15,000 residents used to trek 5 miles and wait 2 days to see a doctor, they now receive medical treatment free of charge at the local government health centre in their own town. Women like Yashoda and her 2 sons visit the hospital to consult Dr. Malika.
The treatment that we used to get from the private hospital, which was very costly, now we are able to get it free of cost. And whenever there is any emergency, we can easily come here and get the proper treatment. And the doctor has been very cooperative. She gives us good medicines and proper treatment. So it has helped me a lot, and also the community.
Before, they used to go to that KR hospital, which is a big hospital, medical college hospital, which is very far away, or they used to go to private institutions. Definitely they'll gain, and because it's a free and it's very nearby, especially for immunization, antenatal checkup, definitely they'll benefit.
The health centre isn't the only benefit for the people of Mysore. Recently, Pushpa Vali worked with local officials to provide 2.5 million rupees to rid the area of Parthenium weeds that were blocking local drains. This caused rubbish to pile up and increased the threat of disease, a concern raised by many women in the area. With the weeds gone and the drains covered, residents are seeing firsthand how gender-responsive budgeting has helped public funds to be spent in a way that takes the needs of women and children into account while providing benefits for everybody.
Absolutely, what we would hope is that every state in India understands what is gender-responsive budgeting and actually starts formulating their budgets so that the needs of women, this is half the population, and all we are asking for is that the needs of the women are also taken into account.
Today, over 60 countries around the world are reviewing their budgets more closely to ensure that money is being spent in a way that is both equitable and reaching the most marginalized members of society. In India, gender-responsive budgeting is already widely applied also at the national level, and UNIFEM is positive that it will soon be adopted on an even larger scale.
I feel that in the next 5 years, we'll be making gender-responsive budget a tool, a must-do tool, which will be used for every section of society. So if that is done, I think, we'll be really talking about social justice, we'll be talking about gender equality, gender justice as we call it. It will really help governments and the civil society to achieve what they aim to achieve, good governance.